We've seen the production line, and now Dr Miguel, who's at the University Clinic of Navarra in Madrid, Spain, is going to take us remotely into an ICU to look at the real-time applications of the patient monitor. Dr Miguel, what's the situation in Spain right now with regards to COVID-19?
In our hospital right now, there are no cases of coronavirus because we had lots of them some months ago. But finally, we are, clean, what we call a clean hospital. We are zero inpatients with coronavirus right now. And we are resuming our surgeries and our normal activity. But there's still much going on outside because the coronavirus patients have been really complicated patients who have suffered many complications during their stay in the ICUs. So really big hospitals all around Spain are still carrying the burden of really difficult patients who have not been able to be discharged yet.
Why is the monitor so critical to caring for a patient with COVID-19 in an ICU?
These patients are a real challenge for us, because they are sedated, they're under profound sedation and muscle relaxation, so we cannot talk to them. So we really do need to have a basic structure on which to stand, on which to build the whole structure of our activity. And that's the role of the monitor here in the ICU. It is kind of the identity card of the patient inside the unit. The most basic thing which describes the status of this patient inside the ICU. Then we could go further and try to monitor many other things that we can also study, such as the echocardiogram, the special tools for the cardiac function. But the main and most basic structure is monitor.
What's the most important aspect you've learned looking to the future? Say, for example, if there was a second wave.
Maybe the most important thing we've learned is that we still know very little about the coronavirus, and that we have to cooperate between different professionals, different countries, something which was unimaginable of a couple of decades before. Now it's really easy by means of the modern technologies. So we have to cooperate, because something which is being implemented in Italy can be used there as well. Something which we are investigating in our hospital could be used somewhere in the UK, for example. And so cooperation is the most important tool of all. But if I was to talk about of this disease on a personal basis as well, I will say that I've learned about humanity again, because I've seen great effort of the people to get these patients out of the ICU. I've seen people working lots of hours with no real resting, afraid as well about getting the coronavirus, or maybe afraid of their family's status, and working really long-term shift hours here, and really focusing on the patient and not thinking of any other thing. And that's been a really huge sign of humanity inside the ICUs.
Dr. Miguel, fascinating insights from inside an ICU room. Really appreciate your time. Thank you.